Hi, Neurofamily. I'm here with the one and only Mary Swingle. We're here in beautiful Brescia, Italy, at the very last day of our Biofeedback Federation of Europe meeting. And I was looking forward to having this conversation with Dr. Marie about her book. So, Marie, why don't you please introduce yourself and talk a little bit about your book?
Okay, yeah. So I'm Mara Swingle, and yeah, I have two editions now out of my book, iMinds. First one, I was writing way back 2014, I think was the first one, and the other one, yeah, 10 years later or so. But writing of the effects of interactive technology on the brain and behavior, and we're seeing extreme emotional effects, socio cognitive emotional effects, not just on children, but all through the ages. And I just felt it was really, really important to get all this down in a way that people can understand. So it's not just a book for professionals, I call it, it's a book for the educated professional. It goes into great, great detail, hopefully not necessarily entertaining detail, but interesting detail. I talk about definitely the science. My research definitely is featured, but also a lot of the cultural components that permitted this, kind of like the perfect storm. I like to also say we can't blame it all on iTech. There were so many converging factors that were occurring that just made it perfect for technologies to take over parenting, to take over education, to take over dating, in fact, pair bonding. I mean, I can go on and on and on. I think the other thing that's important to know about me and my work is I don't tell people what to do. I really don't believe in telling people what to do, but I really believe in informed choice. And that's what I hope my writing, so the book iMinds, also my research, does for individuals. It really shows you the pure science of what's happening, why it's happening, and what you can do about it if you choose to do something about it.
And what I like the most about your book is that it's based on the science. So you've done
Yes.
research with EEG, qEEG brain mapping to back it up. So this is
Yep.
not a book that came out of wishful thinking or a vague mission. This is backed up by the science, and that's what I love about the book and your workshops is that you present that. So
Mm-hmm.
could you tell people maybe the top three reasons based on your brain research why it is important to limit screen time?
Well, number one, I would say, is the arousal template. Now, taking that out of science talk, we're all now functioning in, I guess, a slightly higher level of anxiety, if I'm going to just air quote. Technologies keep our brains going at a very, very fast pace and keep it there. So we have greater difficulties quieting, relaxing, sleeping, feeling good about ourselves. Also, in terms of education, it teaches the brain only to respond to higher stimuli, or again, I'm going to use these air quotes, more interesting things. And, no offense to school and the school system, but a lot of the things that we're learning about, children don't find particularly interesting. It's boring. So we're literally training the brain not to be able to pay attention to things unless there's super, super fast paced ding, bings, and rewards. So it's really affecting the ability to learn. It's affecting the ability to pay attention to scholastics, to other individuals. Again, I can go on and on and on.
Right. Well, that's wonderful, and I think it's very important that, as you say, you're not telling people what to do, but they have an educated choice as to at least understand what the technology could do to their brain,
Yeah.
their mental well-being, as well as their physical well-being. How did you come across? Why did you decide to study the effects of eye technology on the brain?
Yeah, well, this goes back essentially to the turn of the century. At the time, I was working primarily with school children who were coming for neurotherapy for behavioral issues and educational issues. And not to pound my chest too much, but I had a really, really good success rate. And then all of a sudden, there were clients, families, where therapy would be very effective. I like to say off they went into the sunset all happy. And then 3 months later, they were back. The issues returned. Similarly, we had certain individuals where they just weren't getting better. And, also as a researcher, what was happening? And then, of course, I mean, now everybody knows what it was, but in the time we didn't, it was always young male children and gaming. And that's what really, really intrigued me. At the time, I was doing my PhD and I needed a thesis topic. So I just dove in and I think I was the first study recording the effects of what we were calling in the day interactive technologies or internet addiction on the brain. So I have the first, I call it a constellation pattern, looking at exactly what it did to the brain. So, yeah.
It's very interesting. Now, in terms of mental health, I'd be interesting, and I think our viewers would be interested in knowing, in terms of mental illness, what can it exacerbate? Anxiety, depression?
I call it the big three.
Okay.
Anxiety, depression, and anything on the obsessive compulsive realm. And I throw ADHD in there.
So it exacerbates these conditions greatly.
It's a dance between exacerbating and causing. I would go so strong now as to say causing. In the past, it was exacerbating and causing. It's interesting going back to when parents were bringing their children, and let's just say it was a behavioral issue, like massive tantrums, defiance, etc. And the parents would report the behavior and say, it happens when I ask our son to set the table, or when I ask him to take out the garbage or whatnot. They always thought it was a resistance to the chores. They didn't connect that they were asking the child to stop gaming to do the chore. And so once that connection was made for a lot of people, it was a game changer that people started to realize, okay, we know what the issue is.
Right.
Yeah. Same thing with the ability to focus and concentrate, right? The attention span is getting narrower and narrower and narrower because of the new expectations of the brain to be entertained. And if the brain and the person who owns the brain is not entertained, they can't pay attention anymore. Now, we're all pro entertainment and learning. We know if it's interesting, captivating, that's fine. But I'm going to use some other words. In training, so training the brain to only be able to learn when something is interesting, that's the problem. All of us should have the capacity to be present even when we're not entirely intrigued.
Correct. Now, I noticed this is probably more evident as the trend being rather impactful in the people who were born into the technology. But do you see this growing also in the people who migrated into the technology?
Yeah, we digital natives and digital migrants. It's different. I would say our elders are really, really doing the best. They use their technology as a complement, not an override. So they'll communicate with their grandchildren at a distance, but they'll still go out for coffee and whatnot with friends. It's not it's not a replacement. And that, I think, is very, very important. I am not anti-technology by any stretch of the imagination. I use it fully in my practice. I use it in my professional life, my personal life, but not as an override. There's a certain point where you have to turn it off. I also suggest a classic example is please, text or connect a little bit back and forth, but do go out to dinner. Do go out for a glass of wine. Do go out for a coffee. It's the fact that we're not doing those other things. We're only on the devices and not with people we know anymore. And that's my huge critique of quote unquote social media. We're following all kinds of people as if we know them, as if they're our friends, which leaves a vast, vast emptiness because we're very, very full when we're on the devices. And the nanosecond we turn them off, we're empty. Versus if you go out, shall we say, to dinner with a friend, so you spend the same amount of time with a person, eating for an hour and a half, it's a really good dinner, maybe 3 hours. You leave that time and you're on a good high and it stays throughout the rest of the evening and arguably for 3 days after. Okay, so it really fills up your emotional battery as opposed to draining your emotional battery.
So that would be a good way of combating the need for the technology as a supplement for that void in emotions and connection. But also I think it helps rewire the brain to some degree.
Yep. We need face-to-face, heart-to-heart. That's what all of us as humans need. And if you don't get that, the brain, in our business, we do say rewire. You get different connections, or more frighteningly, especially in early infancy, if you don't use it, you lose it. So we're finding a neuronal pruning of circuitry and areas that I would say are necessary for interpersonal relationships and cognitive development. We know there's a great proliferation of autism now, but what we're seeing, I call them eye babies. So parents who have any type of screen device in the cradle, that's all the child interacts with, and or the parent is guilty, they're interacting, the children become very, very halted in their socio-emotional and cognitive development. A key example is the failure of the development of the smile response. Okay? That is huge, and that's critical. The inability to read facial expressions. Okay, that's also where the anxiety comes from. When you can't learn how to read other faces, you don't know a true smile from a fake smile, or a predatory smile versus a protective, warm smile. Volume of voices. Sometimes that's distal communication versus danger. All of these cues, we're not picking them up.
Yeah.
So I'd say we're becoming emotionally dysfunctional.